My dear NEET-PG friends, welcome to this session. And this session is about the NEET-PG, which you're going to face in March first week only. And I have the proud privilege of having our star faculties, Dr. Rajamahendran sir, our surgery educator, Dr. Rahul Rajeev sir, our medicine educator, and myself, Dr. Rajiv Dhawan, your ENT educator with DocTutorials. We at DocTutorials have only one passion: to stand by the side of our students till the last day of the exam is over. And this is one of such exercises we are doing for you. Guys, if I am a student and I'm preparing for the examination and I'm just few weeks away from that, clinical specialties like surgery is very important. They are determinant of our grades, you know it. And who can be better than Dr. Rajamahendran sir to guide us how to cover subject like surgery in the remaining days. So let us hear from sir. Sir, please guide the students and how they should approach surgery in the remaining days, sir.
Hi, sir. Thanks for the invite, Dr. Rajiv Dhawan, sir, and Rahul Rajeev, sir, for inviting me this last-minute revision related session. So this session primarily meant for what to do for the last 25 days. And I would like to give the important things related to my subject on surgery. So surgery, I request you all to spend 3 days to 5 days in this next 25 days, because it's one of the major subjects. Surgery and medicine are going to carry the maximum number of questions. Last year in NEET PG, we had around 40 questions, upfront surgery questions alone. Pure surgery questions were around 40 in last year NEET. So I'm expecting around 30 to 40 questions this year. And the major issue is last session of FMG exam was really a tough exam. The surgery paper was very tough. So very tough in the sense the concepts are same. The concepts what they were asking were same. They asked the same basic concepts of, for example, achalasia. The concepts are same, but they have now went into the depth of investigations and management. Even medicine questions and OG questions, all the questions are like asking more about the investigations and management. So I feel you have to focus on the topic, whichever you have read as important topic. I'll give a list now. You can use those list of topics, but those important list of topics, I want you to read in depth. Don't read superficially. Superficial reading will not be helpful for this recent pattern NEET PG exams, which is going to be future next. They are concentrating more on clinical aspects, investigation aspects, and not even leaving you with investigation. They are also going into the depth of treatment also. So last time the questions were in depth, like parathyroid management, all those questions were being asked. So I feel you have to give 3 days to 5 days based on your level of preparation so far. Even spending 5 days on surgery will be worth. And medicine 5 days will be worth. In the remaining 25 days. Definitely, you have to give more importance to surgery, medicine, OBG. 3 subjects I'm requesting you. Please give focus, importance, and concentration on these subjects. Last year, with these 3 subjects, 100 questions came. We have the pure question paper from the last year aspirants. They are telling 100 questions we can answer only from medicine, surgery, OG. So I'm telling you, this year also we're going to get more questions from medicine, surgery, and OG. And in surgery, so what are the important topics? Let me tell you, the basic topics which are important are, you all know very well, Bailey and Lau 28th edition has come now. So 28th edition may not be asked for you at this point of time, because question paper will be prepared by this point of time. Book came only last week. I'm sure the questions will not come from 28th edition. So you go with the 27th edition. The important topics which are needed for this exam will be trauma. So trauma you have to read in depth, no doubt. So you have to spend 1 full day on trauma. So as emergency related questions are more commonly asked, trauma will be definitely asked for you. So trauma is very important topic from general surgery. And the important topic from the general aspects are surgical site infections. Surgical site infections are important topics like Southampton grading, asepsis scoring, all those things will be highly expected. And advances in surgery like laparoscopy, robotic surgery questions are highly expected in this exam. So advanced surgery, you should be thorough. Advances in surgery like laparoscopy, robotic, you have to read from your material. We have everything given in our DocTutorial app. Advances in surgeries, there is a chapter there. Surgical site infection chapter is there. Trauma, we have given in depth around 6 to 7 hours of video is there on traumas. And I want you all to focus more on thyroid and breast. So breast, no exam is coming without 3 or 4 questions from breast. So CA breast, definitely 3-4 questions will be there. Thyroid, definitely thyroid malignancy, also 3-4 questions will be there. And in GIT, esophagus and stomach are very important. Esophagus and stomach, definitely some questions will come. And hepatobiliary, you have to focus more on gallbladder chapter, gallstones and gallbladder chapter. You have to focus more. And coming to specialties, urology is high yield topic. Definitely 6-7 questions are expected from urology. Last year we had around 6 questions from urology. All are not superficial questions. All are in-depth questions. So you know very well, surgery contents also covers most of the radiology aspects. Also we are covering in that. So many radiology images are also there in surgery books. So definitely you can get more images of radiology images in urology also. So urology is very important for your exam among the specialties. And if at all you want to read other specialties, you can just give superficial study of plastic surgery related skin grafting, and related to vascular surgery, you can read the basics of peripheral vascular disease might be asked. And endocrine surgery, you know very well, it's overlapping. I think you will be reading in medicine also. Endocrine surgery will be read by you, like parathyroid, adrenal, you'll be reading in medicine also. So please focus them in either in medicine or in surgery. Give some importance to those topics. I feel these topics, if you give more importance and read in these last 25 days, you can split up. If you want, you can read continuously, or also you can split up and read those topics. Definitely, these topics are going to be very helpful in the last minute. And I request you all, please go through the FMG question paper we have discussed, which is discussed in DocTutorials YouTube. We have around 2 hours surgery discussion. You know how the questions are being asked. Around 45 questions came from surgery in FMG exam. And all the 45 questions are really excellent questions with in-depth concepts. So we are actually, as faculties, we have ourselves modified the pattern of teaching in the recent exams. So definitely these are the points I want to tell the students. Rajiv. Yes, sir.
Wonderful, sir. In fact, as a student, I learned a lot. To be very honest with you, very informative students. Please make this note what sir has said. There will be vast notes in front of you. What sir has said, that surgery, medicine, OBGY is going to be 100 questions. Means half of the paper is this side. So this is highly prudent to invest 10-12 days on these subjects only. It will be really, really beneficial. So I think the message is loud and clear. Trauma is coming, surgical site infection, thyroid, breast, as sir has said, gallbladder, esophagus, stomach, all these things sir has indicated already which arena they are actually, laparoscopy, robotics and all that. When we know, why not really learn from the master what he's saying actually? Because he every day in and out he's dealing with the question. He knows what topics are important. Guys, this is very important take-home message for all of us. And the next subject which really is very important, and medicine, who can really, like after surgery, if you see equal subjects, medicine, these 2 subjects you make strong along the OBGY. Believe me, we have got a huge chance of making our dreams come true. Who can be better than Dr. Rahul Rajeev sir to guide us how to approach medicine? And sir, next couple of days left with us, please guide us on that, sir.
Thank you, Rajiv Dhawan sir and Rajamahendran sir.
Hi, sir.
So I'll try to keep it very concise and crisp on what my suggestions will be for you preparing for the last few weeks for the exam. So first of all, medicine is a vast subject. And if you feel that, you can revise the entire portions in just 5 days, it might not be possible. So you have got to think wisely. How am I going to revise this subject? So I would say that the revision should be centered mainly around the previous year topics. So you look at the previous year topics and you center your revision based on that. But remember one thing, when you look at the previous year questions, you will find that every question paper has certain outliers. Like draw the normal Gaussian distribution. Some questions will be extremely tough. So don't generalize the paper based on certain outlier questions. So it is like majority falls in that 95%. So I would say that you please focus mostly on the easy and moderate and maybe slightly difficult questions. So focus on those topics, revise your notes, and just trust yourself. Because I'm sure that when you revise medicine, suppose you take 4 days or maybe 5 days for revising medicine and maybe the associated allied specialties, you will always have a tendency for lateral reading. But I would tell you that, restrict that tendency. When you learn about one particular topic, you might want to go more into it, but no, that is not the time. So you try to go in a straight line without too much of deviations. So previous year questions, previous year topics, forget the outliers. Then whichever platform you have followed, I'm sure the faculty would have given you flowcharts, line diagrams, summary points, please focus more on that. Because if you go for the detailed lecture notes, again, it might be time consuming. If you have listened to my classes on arrhythmias, I come to a final basic approach on the approach to tachyarrhythmias, approach to bradyarrhythmias, where in that one flow chart, everything is summarized. So please go through these summary tables rather than going through the exhaustive lecture notes. Then one more suggestion is when you go through these previous year topics, it will be nice if you can quickly go through the allied subjects as well, by which I mean, suppose you are learning treatment of myocardial infarction. You can quickly brush through the anticoagulants and antiplatelets in your pharma as well, because then that will help you connect better when it comes to clinical scenario-based questions. So I think though a proper system-based approach may not be possible in the shorter time frame, and believe me, like you will always have that feeling of incompleteness. Even if there are 3 weeks, or even if I give you 3 years to study, the last couple of weeks, you would always think I need a few more months. That is definitely going to happen. So nobody has ever attended the exam with a complete reading, just like you did in your school. You would finish everything, maybe 3 rounds of revisions, but that is not possible. So accept the reality that you can only go to the exam hall with a bit of incompleteness, but always remember, when you learn, just try to keep your composure. And the vast topic like medicine, or a vast subject like medicine, you try to go through areas you are likely to forget. If you are having certain weak areas, just think, okay, arrhythmia topic, I'm not so good in it. Just go through it a few days before the exam, so that even if you see an ECG question, you're not on the back foot, you are on the front foot to play the shot. So I think those areas which are likely to trouble you, just go through that. If you're having doubts in the management of stroke, just go through that. If you're always confused between iron deficiency anemia and thalassemia minor, how to differentiate, we know that always question comes from that. Just go through that table, differentiating iron deficiency, thalassemia, and anemia of chronic kidney disease. There has to be a question from that. Never neglect the basic topics like pulse, JVP. Quickly go through these abnormalities, and that is enough. Okay, so I would always tell you that in the remaining time, remember, each subject devote a specified time frame, and within your capacity, please do your best. But don't get unnecessarily stressed out that you could not revise entire medicine, because one thing good about all the clinical sciences is that certain questions you will be able to answer reflexively. Like even if you did not read, if the clinical scenario is that of a ST elevation myocardial infarction, you will remember at that time, okay, this is what my faculty told me. This is what the window period is. Okay, I will go for this management. So this is not a theory exam. Certain questions will come reflexively, you will be able to answer. So that is what I want to tell you. So I think, it's all about maintaining confidence. And Rajiv Dhawan sir, I have a question for you. Like, if you were a student, like all these students listening to us, how would you plan your remaining days? What will be your strategy? And I think, how do you keep your confidence level in the remaining few weeks? And I think that is what everybody wants to hear as well, because it's a mind game or as well, this exam.
True, sir. And thank you very much, sir. Students, you must have noticed Dr. Rahul Rajeev has told us very beautifully that, guys, it's a time to go high yield. High yield, you know what? You can't read A to Z, but you can definitely read what actually, you think from the retrospective analysis of the MCQs, what's more important, revise that. And as sir told, something is always in your mind. Whichever you studied in final year MBBS even, it's there, somewhere there. A question comes, you'll be able to crack that. Don't assess yourself only on the basis of what you studied in the last couple of months only. You have been studying a little bit here and there. Be available. So sir, to your question, between surgery and medicine, other subjects also contribute to the, the rank. So to make the students' life easy, DocTutorials coming up with an ENT revision. So Valentine Day, doctors are different people, we're different creatures, it. And so we will be celebrating Valentine Day with ENT. Sorry for that, guys. But the idea behind that is to make sure that you don't waste too much time for ENT. You should be able to conserve your time for medicine, surgery, OBGY subjects. We would be having closely 2 hours session on YouTube, our channel only, to make sure that you cover all the PYQs and the expected question for the upcoming NEET PG for ENT, number one. And now, as sir said, how I would have planned my remaining days if I'm appearing in the examination. Number one, I would take my master's, words very seriously. Rajamahendran sir, Rahul Rajeev sir has told us medicine, OBGY surgery is 100 marks. I would really write in my heart, I am going to give too much significant time to this preparation of these subjects. How to prepare now? Guys, previous year question are important. FMG paper surgery, as sir said, he has put 2-hour video over there. It's a wonderful revision. Even I've seen that. Must see that better. It's not a time to go anti-grade, retrograde, let's go that. Every day, my humble request to all of you, please do not study less than 13 hours. Dr. Rahul Rajeev always says it is too much, but I always say this is the time to deliver. These 3 weeks are going to decide next 30 years, man. Please understand. You are not like you are part of a family. We are part of one fraternity over here. We must guide you like younger brothers and sisters that these 3 weeks going to decide my 3 decades. I should be burning myself. Every hour I should be studying, except for 5 hours of rest at night. 1 hour in the daytime I'll take rest. I will study because this is what is, we can't run away from it. We have to really give our level best. So nobody should motivate you. You're wise people. You are smart chaps, and just write on the wall. These 3 weeks will decide next 3 decades. I have to study. Oh, the biggest question will come suddenly. But my friend is more prepared than I am. That is the biggest problem right now. Let them live their life. You live your life, man. Almighty is the ultimate deciding factor. Don't worry. 80% in your hands. You do your bit. Your pharma is weaker. Don't worry. Somebody else's biochemistry is weaker. Oh, your OBGY is weaker. Don't worry. Somebody's PSM is weaker. We always analyze ourselves in a more negative way. Let's not do that. Let us play our game best and leave the rest to God. Our game best, my game. I'm not saying you compared to your neighbors, but it's a human tendency. That's what we are here for, as your elder brothers over here, to tell you this is a normal, natural human trait to suddenly get comparative when we get dedicated. Forget about that. Learn from our mistakes, I would say, and let your full potential come out right now. Couple of things I would like to tell you. Please keep last 3-4 days for a very concise, quick review of the things which you would have done by 28th February. Okay. In the last 3-4 days, only must see surgery images, pathology images, microbiology images, radiology images, dermatology images. Surgery, medicine flowcharts have to be seen one more time. Please mark that flowchart. This is important arrhythmia or flowchart, stroke management flowchart. See them in the last 3-4 days. Must see the oncological stagings of breast, thyroid, whichever, gynecology, ENT, wherever you think you are, in the last 3-4 days. And let me tell you, we'll be coming back again to meet you on the same channel just a couple of days before the exam, so that we are able to make sure our students do not have the last minute butterflies on the exam day. They are able to perform the best. Will not take much of your time, bache. Only have this feeling that DocTutorials is standing by your side as you are preparing for such a vital exam of your life. We all have got only one, passion, that you come and deliver your best in your life, in whatever specialty you join. And this is actually a very crucial step, sir.
Thank you. Thank you, sir. Thank you, sir.
All the best, everyone.
Thank you. All the best.